All right, we're in business. Okay.
All right, why don't you zoom out a little bit?
I saw that.
Yeah.
There.
Yeah.
So this is a lot of profound stuff, so that's why you've got notepads to take notes and circle questions where you want to circle back if you things you want to ask me in more detail. So this is typical of what we see sometimes when people are out of balance. This is a 51-year-old male, high blood pressure, high cholesterol, and guys tend to get a lot of belly fat around through here, and they don't tend to get it around the sides like a lot of women do. And to cleanse, and one of the reasons that when I have couples do a cleanse together, sometimes the guy will lose a lot more weight through the front than his wife or his partner will. It's the different makeup of male hormones versus female hormones, and sometimes a little less estrogen. But this chap did a cleanse program as part of his nutrition program, and he was able to come off blood pressure medication, cholesterol medication, and after he lost his weight, he said, not only can I see my toes, but I can touch them for the first time in 15 years. And this is someone who wasn't particularly in tune with their health. Their wife was in care, they dragged him along, and they wanted to do the cleanse, and they made him do the cleanse with them. He got these results, and to be able to see your toes for the first time in 15 years and to be able to touch them is huge, but also coming off these medications were huge for this guy. And you know, he had no expectations apart from he was supporting his significant other in doing this, and very profound. When you think of health, there's a lot of things, a lot of definitions to these, and when we're looking at health, we're looking at a dynamic balance, and that we can cope with everything. And you know, this makes me laugh every time I read this, because this is a state of health characterized by anatomical, all of your muscles, physiological, how everything works, psychological, how everything, the way you think and interpret things, and the ability to perform personally, family work, community roles, deal with physical, biological, psychological, and social stress, with freedom from the risk of disease and untimely death. And I think that's pretty much baloney, because we just don't get to do that. We don't get to have absolute balance in every single area of our life. The thing that I want you to focus on is the fact that it's a dynamic balance. And we all know when there's something out of balance in our lives. We know when either work stress is too much, home stress is too much, or the stress of running our body is just too much and sometimes feels overwhelming, things are breaking down like that. And we want to be aware of this dynamic balance, and if we can identify where we're going out of balance, we can focus our efforts into bringing that balance back so we feel a little more dynamic and able to deal with these sort of situations through here. The life expectancy in the US, most of you are familiar. This hasn't changed too much apart from the generation that's growing up now under the age of 25 are given a lower life expectancy for the first time in the last 100 years. They expect the under 25s to live longer than present 78 years, which is where it is right now. And one of the problems with this, we all know, is a lot of people lose function and they're kept alive by different medications, which is important for health, but it doesn't always increase the value and the dynamics of their health. They don't always necessarily be able to do things a lot better, and we want to be make sure we live our lives and we're not just adding years. Increased longevity without quality of life is an empty prize, and we don't want to go to those areas through here. As far as diabetes, we've got 26 million, so that's 8.3 of the population in the United States. In 1980, this is just 37 years ago, it was just 6 million. And this has escalated like crazy. Now, there's a lot of reasons for that. The food supply is a little different. There's many different reasons. Schools have cut back on budgets for foods. I think that might all change in the future, but Kids are not as robust as they used to be. The number of new cases of diagnosed diabetes has increased by 54% in a 10-year period through here, which is huge. And there's individual causes. A lot of people, the plentiful nature of cheap food, or quote unquote food in supermarkets. We're all very familiar with shelf lives and marketing of people like Nabisco and places like that. They're in business to make money, and they're in business to maximize shelf life. And if you have something sitting out and it doesn't go off for a while, you've got to think, why didn't it go off? And we all know foods that will do that. There's several foods that you can leave out if they're highly processed. They may not go off and go moldy, but the availability of cheap food, poor quality food, and overeating is a big one. Sedentary lifestyle is huge. A lot of kids in the last 20 years don't move around as much, especially with the advent of handheld computer devices. They're not always out running around and playing like they used to be. And the same for adults. A lot of adults don't get to get up and move around as much either. Food manufacturing, we kind of touched on that. Foods that increase appetite. You're all familiar with things like Pringle chips, right? Like if you didn't know better and you were a youngster and you had a Pringle, you would think, oh, that tastes kind of, because I've had one, so I know this, I've experienced this before myself. You think, oh, that's kind of a little tangy, it's a little zangy, maybe I want another one. And things like MSG, monosodium glutamate, it's a flavor enhancer. So it dilates the flavors and the flavor receptors on the tongue. Instead of being this big, they come out to this big. And so you want more. Oh, I can taste that. And that's what MSG does. And those sort of foods, and they used to put it in a lot of, we remember this, they used to put it into a lot of Chinese food, right? And MSG was a big thing in Chinese restaurants, 20 years ago. People would get a headache after they had they went out for a Chinese, and maybe it had MSG in there or something like that. So there's a lot of additives that can go into foods that increase appetite to sell more units. Increased inflammatory reactions with food. We see this all the time in the United States and in the UK. People are more reactive to foods more than they ever were, especially wheat-based and milk-based food. And has the quality of the milk changed? Has the quality of the wheat changed? Sometimes, in the United States, you're allowed to have genetically modified wheat over here. That is banned in Europe and the UK. Because when you get something that's genetically modified, one of the things that happens is the food, stand over here, there's you, let's give you a shoulder on that side, and here's the GMO food that comes up. So the GMO, it can be corn, it can be wheat, they're the two most common ones in the United States. So let's say we got GMO wheat coming in there, so we've got GMO bread going in there. When this goes into the body, says, wait a minute. The brain goes, that's kind of like wheat, isn't it? And it gets into a bit of an argument with itself. So it says, well, it's got these things that look like wheat, and it's got this other thing that's slightly different, and it doesn't quite know where to put it and how to utilize it, because instead of having a round peg, which is called wheat, going into a round hole, it's got this slightly different shaped peg, which has been genetically engineered, and it doesn't quite fit into that hole in the body. So those types of situations can create inflammation in the body. Can you guys see how that works? Okay. So we tend to get a little more inflammatory reactions to this. And plus the storage times on wheat are different too. I see patients that will go to Europe and they'll have terrible gluten sensitivity or full-blown allergies in the United States. And we'll be helping them with that in their nutritional programs and their diet programs. They'll go to Italy or France, they'll be eating baguettes and they'll be just fine. Why is that? Because the wheat's different, okay? So there's different ways of food manufacturing, there's different processing from country to country. But we're definitely seeing a lot more inflammatory reactions to food. The other thing that we see is we have this thing called molecular mimicry that goes on in the body. where we have something like a virus, a flu virus comes in, or we have a bacteria that comes in, and it influences the body to attack itself in an autoimmune type way. We see this with pancreatitis, we see this with autoimmune diabetes, where you have a virus like rotavirus would be a common one, which every single one of us in this room has had this as a kid, where you get runny diarrhea and you're sick for a while. It's a bug. That can look very similar to pancreatic tissue, and in some cases it can confuse the body into attacking pancreatic tissue. And we see it with human papillomavirus too, HPV. You see it with that too. You also see it with H. pylori, which is a bacteria very commonly found in the stomach. Both of these will mimic pancreatic tissue, and if it agitates the body enough, the body will go up and attack the pancreas. So there's a lot of different things that can do that, and there's a lot of environmental toxins that can do that too. So there's a lot of reasons for why people are working harder and not doing as well. This is the National Institutes of Health over in Bethesda. A 15-pound weight reduction reduces the risk of getting type 2 diabetes by 58%. That's huge. And that's just 15 pounds of weight. And if you're over the age of 60, losing 15 pounds reduces the risk of getting type 2 diabetes by over 2/3, 71%, which is huge. 65% of all adults in the United States are overweight. 34 are considered, 44, that's now 35% are considered to be obese. That's over a body mass of 35. And this is the trend. This is 99. This is reasonably recently. This is just, 37 years ago. And you can see the number of Americans in states that were 10 to 14% overweight, or a body mass over 30, or over 30 pounds, that are in blue here. We go forward 10 years, and we see that now most of the area is over 10 to 14% like that, apart from Colorado. And then we're up again another 10 years later. We've got 25, 29%, over 30% down through there. And that's the most current one, where we've got over 35% down in the south east, but this is all 30% right through here, Oregon right through here, all western states. For some reason Colorado seems to be the healthiest state with regards to weight.
That in Hawaii,
As in Hawaii.
but that's not very accurate.
Yes. This is correct. We're in 2018. This is exactly 74.9% currently in the United States. That's Johns Hopkins University. This is very common now. This figure is elevated to almost a third of the adult American population now. There is no treatment for high blood pressure allopathically. They look at it very mechanistically, like, okay, the volume's too much, what do we do? Control it with beta blockers to shut down the output of the heart, control it with ACE inhibitors to make sure that the vessels dilate a little more and give you a diuretic so it reduces the volume. But they don't actually go, okay, why is the blood pressure a little higher? You know, when blood pressure increases in the body, there's a reason for that. It's trying to get more oxygen to somewhere in the body. Our job is to figure out where is that. Take the stress off the body so that can go down, and that's how you work with high blood pressure. And sometimes you have to work with medication too if it gets too high. But it needs to be an integrative approach. Okay. This is increasing too. And this is the American Journal of the Heart Association here. So we've got some challenges here. This is a big one which surprised me. This is the American Cancer Society, and they claim that over a third of cancers are directly linked to dietary choices. This surprised me because I thought that was a lot. So So poor diet, obesity, and activity. We can get into some of these loops in life, right? We can get into jobs which are sedentary. We can get into injuries or inflammation that limits our activity. And sometimes we can get into a vicious circle on those things. But what you need to remember with cancer, let's just go back here for a second, is what is actually happening with cancer. You've got a situation where you've got a cell. We've all got cells in the body. You guys all did high school biology, right? You remember the cell. So if this gets stressed, what happens, right? We see this in the esophageal tissues. We see it in the cervical area of the uterus. We can see it in skin tissue very easily, where we get a little bit of stress and we get a little bit of dysplasia, which means the cell replicates, but it doesn't quite replicate right? If the stress stays on the body, it'll go all the way to crazy neoplasm, where it doesn't look like a cell at all, and that's neoplastic, which is cancer. What you have to remember is this is a two-way street. The integrity of the cell, the health of the organism, and the cellular situation, if it gets stressed enough, can go to here. If that gets stressed enough, it can go to here. But also, many times, this is happening a lot in the body. And this is happening a lot in the body, where we're getting dysplasia going into neoplasm and it's coming back this way. Only when this gets expressed fully, the body's unable to get back this way, okay? That's why you see some people do very poorly with cancer, other people go into remission. Okay. And a lot of these things happen before you get any symptoms because the body's fixed itself. Okay, we have to remember that. Does that make sense to everybody? Okay. This is a 49-year-old who had high blood pressure, a lot of weight gain over several years, a lot of fatigue and sugar cravings and heartburn. This is a very common patient situation. Sugar cravings, fatigue, heartburn. We put her on a nutritional program with a 3-week cleanse. Heartburn went away, less fatigue, lost 50 pounds, and was able to get off blood pressure medication. You know, her life's a lot better, and that's just 5 months. Okay. So what we're looking at is assessing and intervening to improve the way your body works. Okay. How the cells work, how the cells signal, improving emotional and cognitive function, the way your brain thinks, the way you start to develop new habits. Because everybody has habits. We have good habits, we have bad habits, and we just have habits, right? That are not good or bad, right? Well, actually, we just have habits, right? It's up to us whether they're good or bad. So we work on some of these things. And we look at genetics. Some of you have little genetic things that you picked up from your parents. We can now get a lab test and see what those are. That may mean that you're more susceptible to not processing something in your liver, or you're more susceptible to anemia or something like that. We know these things now. We can look for them, and they're not expensive. And we can do things with physical function where we can get the body moving a little bit better. But this is what we're looking at. We're looking at changing, affecting the diet, getting some good movement, getting rid of pain and inflammation, and getting some good cognitive skills and habits, and some good brain health. This is what we're trying to do at the end of the day, and this is what the basis for all purification programs. We're trying to create a better situation for this cell. We're trying to take the toxicity, because a lot of times we're deficient in different areas and we've got toxins. We're going to talk about toxins later today. We're trying to improve cell function. I love this poster. This used to be all over the clinic when I started practice 20 years ago. We're not so concerned about this. I'm concerned about this. What's going on underneath? Where's the symptoms coming? I don't care about the symptoms so much. It gets my attention, but I want to get to the cause and get rid of that symptom. It always reminds me of the tooth somehow too. I'm glad I'm not a dentist. We see this a lot. Lab work is fine. Somebody comes in and they said, "Oh yeah, my general practitioner said your lab works fine," and they did maybe a screening glucose, screening lipids, and maybe they did iron, maybe they did one thyroid marker, maybe they did vitamin D if I was lucky, and the wind was blowing behind them when they went in, maybe they did that. So they're just looking for frank pathology. They don't care so much how you function. That is changing in some doctors. They're trying to go to a little more integrative approach these days, but it's still very, very slow. This is a patient that came in, this top guy here. He says, well, yeah, my lab works fine. He brought it over. We ran his blood work, and we ran some important markers. He had autoimmune thyroid, which meant that his thyroid was attacking it, so his immune system was attacking his thyroid, which explained why he was so fatigued. He also had high uric acid levels, which is a precursor to gout, which is a lot of pain, crystals in the feet, in the toes usually, and a lot of pain. And he was complaining about fatigue, memory, fiber, and joint inflammation, and they didn't even check these things. So it's another person who couldn't get to sleep, couldn't reverse hair loss, and didn't have a lot of energy. They were saying her blood work was fine. We did an adrenal stress index where we had her spit into a vial when she got up in the morning, the middle of the day, 4 o'clock, and before she went to bed, to see what her cortisol level was. And the cortisol level was completely flipped. It was absolutely on the ceiling when it should have been resting at night, because when we wake up in the morning, our cortisol level should be up here because we're getting up. That's what wakes us up. And it goes down throughout the day, and it goes down here, so we fall asleep. Hers was exactly the opposite. No cortisol in the morning, and it's just screaming at the night. No wonder she couldn't sleep, right? So, and no wonder she couldn't lose any weight. And when you get enough out of balance, you can have symptoms such as hair loss. It's not uncommon in men and women. And it's not just aging and you're losing your hair because you're getting old. It's that you can have some hormonal imbalances and you can start losing your hair too. And this last one had his yearly physical. They sound great, and he says, now can you do my blood work, so I want to see what's really going on. And he had very high C-reactive protein, which is a marker of cardiovascular inflammation that we routinely check. That's very high. He had a urinary tract infection. They missed that, and he had a high level of blood sugar in his urine, and he had very low levels of vitamin D. If your vitamin D levels are lower than 33 or even lower than 50, you can have more susceptibility to aches and pains in the body. So we always want to make sure that vitamin D levels are decent when they're coming up. Now, if you take vitamin D, does that mean your levels are going to rise up? Not necessarily, because if you've got weight imbalances, if you're overweight, the vitamin D will hang out in your adipose tissue, and it's hard to get out of there. So we have to release the adipose tissue to get to the vitamin D, and a lot of times that will falsely elevate it. Nutrigenomics is what I was talking about earlier, which is how we can look at your genetics to understand how your body works. And these two, this is a great read. This is a New York Times and a Wall Street Journal journalists. So they're not scientists, they're journalists. So they know how to write so you don't fall asleep reading the book, right? But this is talking about the mapping of the genome, which occurred in 2003, which allows us now to know every single gene that we're made up of, right? And we can look at sequencing. And this is interesting because it made us know that we could modify, we can affect your genes, what you've been given, with diet, nutrition, and environment, right? Sound cool? Oh, I don't know. It's the end of the day. But no, very, very good stuff here. And so when we're looking at this, when you think, my mum's got this, my dad's got this, what about me? It doesn't mean that you've got everything from your parents. You've got this internal and external environment too that you can modify. So it's not like you've got a great chance of getting it. I like to see it as a split of thirds, You can modify your internal, you can modify your external environment, and then there's a third of your genetics that's going to come in there. Okay. And when we get down to coming back to on a cellular level, which is what we're going to talk about today, is Nearly every disease is a result of a cell not functioning optimally. If you're getting an infection, your immune system can't quite fight it off. Cells not, got enough oomph to do that. If you're getting, blood sugar issues, your cells aren't robust enough in the pancreas to handle that onslaught. If you're getting high blood pressure, your cells in your arteries, or your cells in your liver or your kidneys, they're very common. The renal and the hepatic the organs are huge. So a lot of times when they get stressed, they start driving up blood pressure. And so a lot of times if you can work on the kidneys and liver, the blood pressure will come down. And then the reason I leave this slide in here, cells make everything, whatever. But you can see the size of the lungs in here, the size of the liver, the size of all the tissues in the intestines through here. A lot of stuff going on here, and a lot of cells that can get irritated. And the body can take a lot of punishment because it's not made for optimum function. The body's made to survive, which is why you'll see an older person bent over like this and walking, and they'll be 96, but they'll be fine in this position. You try and straighten them up, they'll kill you, because that's how they're compensated. And the same with the heart. If you've got high blood pressure, that left ventricle is just going to get bigger and bigger. And you'll see that when you take bodies apart, or like I used to do. When we used to dissect people, we'd have an older person and we'd know how stressed their heart was by how big it was. Because it'll enlarge, the body will do as much as it can to try and handle the stress. So we're going to look a little bit about cholesterol. Cholesterol is a big conundrum. The thinking is changing now. It used to be that cholesterol was really bad and everything had to be focused on getting down cholesterol. And that's starting to change a little bit now. Cholesterol is very important for the brain. It's very important for your hormones, that's your drive. It's very important for your sex drive, your sex hormones, both estrogen, progesterone, and testosterone, which all of us have in it. Just different ratios between men and women. And it's very important for cells. The cellular communication, the phospholipid borders around these guys, that's all cholesterol based. And what they found out, there's this ongoing study in Framingham in Boston, and they started this in 1947 with the same families. I think they're on their third generation now, and they're gathering all of this information on heart health. And one of the things that they've noticed is increased cholesterol does not lead to more cardiovascular heart attacks or events. That's the big news. Okay. It's inflammation in the vessels which leads to that. When you get inflammation in the vessels, cholesterol is a repair mechanism that goes down. And what they're also finding is that over the age of 60, a higher cholesterol is actually beneficial. Okay. So this hasn't completely filtered down to GPs on the street, but a lot of docs are paying attention to this, both integrated physicians and medical doctors now. Lipid panel is something that measures cholesterol. It'll also measure triglycerides, HDLs and LDLs, non-fatty liver disease, non-alcoholic fatty liver disease. We see this a lot when people have consumed a lot of sugar over their lifetimes. It'll look like an alcoholic liver, but they haven't touched any alcohol. They've not been abusing alcohol, and it's because the liver's been stressed by too much sugar, and you see that non-alcoholic fatty liver disease. The side effects of statin drugs, and there's natural statins too, and we even have some natural statins that we use occasionally. But you need to know the side effects of these. The first thing that happens with a statin drug is it'll attempt to bring down the level of cholesterol, but it will also give you brain fog, it'll give you fatigue, and it will give you a decreased libido, because that's the three areas that cholesterol is really big on in the body, right? So this is the liver. So when your body's making cholesterol, it's just doing what it's told to do it because it's getting too much sugar in the body. Okay, that's how cholesterol increases in the body. It's a little cholesterol climb for you guys. What happens to excess sugar if you don't use it? I turn it into cholesterol and triglycerides, which is a big word for fats. But if I keep the cholesterol and fat in me, I'll get sick. So we're going to try and put it somewhere else. They'll combine it all into this package and package as a very low density lipoprotein, which is a fat protein molecule. So he's packaged it up because we can't use it, and it puts it in areas that we generally don't like, all around the middle. So you get that big waist to hip ratio, right? Which is the biggest single predictor of heart disease, if your waist is bigger than your hips. That's what happens. And when it gets deposited there, it's 7 times more difficult to get the damn stuff out. Okay? That's why when we're looking at a purification program, we're getting down through some of those layers so we can accelerate this stuff. These are the factors that are modifiable for heart disease. These are things that you can modify yourself. Your weight, level of cholesterol, abnormal blood levels. This is especially more talking about triglycerides here. And low density, the very low density lipoprotein. Diabetes, high blood pressure, sedentary lifestyle, and smoking. Not many people smoke these days, which I think is a good thing.